So the first question of the day is, why do people want rhinoplasty or a nose job? Well, there are two main reasons. One of them is functional. That means that you have problems breathing, you have problems sleeping, your septum is deviated, and that's called a functional rhinoplasty. And the second reason is aesthetic or cosmetic. That means that you don't like the appearance of your nose. So I've now arrived at our lunchroom, and the next question is, how long should I take off if I undergo a rhinoplasty? It's actually not that long. Most people take off for about a week, and then they go back to work because the cast and the plasters and the sutures are removed after about a week. If you want to play it really safe, take 10 days. And what you'll see is that most people won't even notice that anything happened. I've arrived in the locker room, and the next question is, what kind of anesthesia do you need when you undergo a nose job? Let me see, I do probably about 95% of all the nose jobs that I do under general anesthesia. That means that you're asleep and that you don't notice what's going on. Okay, I'm slowly on my way out. The next two questions are, must the nose be broken, and how painful is the surgery? Let's start with, must the nose be broken? That really depends on what you want to change. If you just want to change the tip of the nose, you don't have to break the bone, because that is cartilage. You just have to reshape the cartilage. If your nose is broad, here, or if you have a big hump, and we lower the hump, very often we have to also modify the bone. I hope you see the beautiful windmill in the background. I'm on my way home, and the next questions are, how much bruising and swelling should I anticipate, and how long does it take until you see the final result? Well, mostly after a week or after 10 days, most of the swelling and bruising is gone. And when we take off the cap, the plaster and the tape and the sutures, most people won't even notice that you had surgery. I'll get back to that topic later. And for the final result, we always say it takes about 1 year. 1 year for all the swelling to be gone, mainly in the tip. So the dorsum will probably lose all its swelling within the first 3 months, and the tip can take up to a year. And in some people with thick skin, or where there's been a large reduction, it might even take up to 18 months. That doesn't mean that your nose is fat and ugly for 18 months. No, your nose will be beautiful after the first week, and then it will only get more beautiful as time goes on. Now on the outskirts of Amsterdam, just about home. And the next question is, what is the difference between an open and a closed rhinoplasty? And if you use an open, do you see the scar? Well, a closed rhinoplasty has incisions only in the nose, here and there, so there are no visible incisions. An open rhinoplasty, in an open rhinoplasty, you connect those two scars via a little incision there. So the difference is exactly 4 millimeters of skin incision. The open approach gives a better view of the nose, and I'll use that in redo noses, in really large noses, or noses that are complicated due to severe deviation. The closed approach in simple hump reductions and simple tip corrections. The scar of the open approach you'll obviously see after the first week when the sutures are removed. but then as time progresses you won't notice it anymore, and after a year, if sutured correctly, there will be no visible scar. And the scar is in a location, I call it that the only people who see it are dogs and lovers, because those are the ones that look at your nose from below, and for the rest no one will notice your scar. Thank you for watching. Like me, follow me. This is Dr. Bart. See you later.